Um, Hi, patients. Welcome to a new episode that we have in the office. Ask Dr. Goyette, where Dr. G answers your questions regarding your health, your care, or the zone technique, or if you just want a clarification on some things. So today's question that Dr. Goyette will be answering is, and patients ask this numerous times. The question is, do you push harder on the points the second time through?
Okay. And I think what you're referring to is patients are asking, when I feel the back of the head, I'm pushing on points, 6 points that correlate to the different parts of the brain that run the six systems in your body. So, in order for me to know exactly what I need to do to get that patient into healing mode, I go and I push along the base of the head 6 points to identify which system or systems are out of balance. And then, based on that, I will go back in and start adjusting and stimulating 4 points on their spinal cord that correlate to the different part of the brain, that when I stimulate those points, it's resetting that particular brain center that controls that system. And the last thing I will do after I stimulate the cord points to get them into healing mode and return that brain center into self-regulating those organs that they control is I'll have them go back face down and I'll feel those points again, because I want to make sure that we put them into healing mode and that the brain center is self-regulating before they leave. And so what they notice is there is a significant difference in what they felt when I first palpated those points compared to the second time after I reset the brain. And because it's such a significant change, they often think I'm actually not pushing as hard or I'm on the wrong spots. So to answer that question, not only am I pushing as hard, I actually push harder because I know that it's going to clear and it will feel significantly different. And I want them to really understand that that part of the brain is resetting properly and it's balancing, it's self regulating at that point. And yes, I am pushing on the exact same points. There are landmarks on the head, so I know exactly where I need to go back into those points. If if I was to go back and they were still tender, I would go back in and stimulate those points again to make sure they were fully balanced before they left. So that's why I have them flip back over. And yes, we're pushing actually harder to make sure that they're self-regulating.
All right, there you have it, guys. Thanks for answering that question. Actually, we do have patients that think that you're not pushing as hard the second time through, and hopefully this answers their question. So for patients, if you have a question you'd like to ask Dr. Goyette in a future Ask Dr. Goyette segment, send it our way, and we'd love to hear from you. So and yeah, we'll see you in the office very soon.